Welcome to Moments with Marianne. I'm so delighted we're spending this time here today. We have a very inspiring show coming right up with special guest Dave Chase, and he's here to share with us his new book, The Opioid Crisis Wake-Up Call. Healthcare is stealing the American dream. Here's how we take it back. Now, Dave is a co-founder of Health Rosetta, which aims to accelerate the adoption of simple, practical, nonpartisan fixes to our healthcare system. So let's welcome to the show, Dave Chase.
Well, thanks for having me on. I really appreciate the opportunity.
What a pleasure it is to have you here, and this book is so timely. My goodness, it must have taken you forever to do the research for it.
Yeah, I really was digging into it for particularly the last 2 years, but a lot of great resources to draw from. So it's well worth it.
Well, so what inspired you to kind of dive into what's going on with the opiate crisis that we're dealing with? What inspired you about that?
It's interesting. There's kind of two drivers. One is, of course, you hear a lot about the issue in the news, and so certainly aware of it from that standpoint. But the less obvious way into it was I've really been studying our healthcare system at large, and in particular what I've been looking at is how we've really devastated primary care in the U.S. And as you dig into that, it becomes very clear that in many ways the opioid crisis is a manifestation of our primary care crisis. It is a complicated issue. There's several factors at work, but nothing has created more fertile ground for the other drivers of the crisis than our undermined primary care. And so I didn't think that studying primary care would get me here, but once you do, then it becomes quite clear that unfortunately the opioid crisis really isn't an anomaly. It is our system and what it's become. And unlike other great public health crises that came from outside the healthcare system, this is one that you could call it a self-inflicted wound.
So, Dave, if we're looking at it that way so our listeners can better understand, what are some examples that our healthcare system has had this it's kind of bottoming out in some ways?
Yeah, what's happened is we just have paid for just kind of doing stuff to people rather than paying for their health. And the way in which we do that has turned primary care appointments into these kind of drive-by experiences that, the primary care docs have been put in an unfortunate position where to make a reasonable living, they have to see patients in 7 to 8 minutes. And it creates this terrible dynamic that, imagine in 7 or 8 minutes, people come in often with more than one issue, and you're trying to understand what their issue is, and, as they call it, having an exit strategy. How do you get out of the exam room? And so a convenient exit strategy is something like writing a prescription, ordering a test, referring to a specialist. And so, writing a prescription, of course, plays into the opioid crisis, where somebody may be coming in with something like lower back pain, and even though there's basically no evidence that opioids are the appropriate way of dealing with back pain, other than they can in short term deaden some pain, but they don't get at the root cause of the issue. We have this terrible dynamic where people are getting prescriptions where there's no evidence, and where there is evidence of how you deal with an issue like lower back pain, with things like physical therapy are very effective. We're just making it difficult to access those evidence-based things, and too easy to access a pill that really doesn't solve the problem.
You're so right on that. I know, I've been in a couple car accidents, and when, just trying to get to, physical therapy or a chiropractor, it's almost impossible. Most insurance doesn't really cover that unless you've had some injury, and let's say it goes on for a period of time. It's, you're kind of limited on that, which really would be more beneficial than a pill.
Yeah, as we're talking, I'm actually sitting at the University of Washington, which had one of the best pain management clinics in the country a couple decades ago, and basically it got, blood dry because for exactly that reason. Insurance companies weren't paying for that, and so it kind of just went away, unfortunately. And meanwhile, there was a dynamic where pain became a big focus, which that's good, in terms of addressing the pain. But then there was some bad information given to primary care docs in particular that opioids weren't addictive, which is kind of amazing to think about in retrospect. And so they thought, oh, well, this can be a solution. It is a way to get out of the exam room and address the pressure that they are under. But it's really unfortunate, what's happened as a result.
Yeah. You really approach the opioid crisis in such a way that people aren't really looking at it this way. So I'm so glad that you wrote your book, The Opioid Crisis Wake-Up Call, because it's a totally different way of viewing what's happening with this.
Yeah, there's a dynamic where if you don't fully understand a problem, the so-called solutions aren't going to solve it. And I found 12 major drivers of the opioid crisis. And if you look at a lot of the efforts to solve the problem, they're getting at one or two, maybe, but they either have no effect or in some cases actually have a negative effect. If you, for example, cut off somebody who's already addicted to an opioid and don't give them a good alternative, the street opioids like heroin and fentanyl are readily available, often for less money. And so that's one of the reasons that, the deaths from opioid overdoses have spiked even more in the last couple of years.
Wow. Yeah, it's just horrible what's happening, and to think it's something that, we could, if we restructure how our healthcare system addresses people, it can totally shift.
Yeah, I really, I outline the problems in the book and in talks I give, but really the message I deliver is this is very solvable. Here's how folks are already solving it. One of the case studies I have in the book, I actually have it in my TED Talk, is on Rosen Hotels, which is just a remarkable story. I'd love to share it, but I'll just touch on one point. And that is, after all these amazing things that they did, I went back and said, what are your opioid prescription rates? And they looked it up, and it turned out that they're at 1/6 the level of prescriptions that a typical, scenario is going to be with other employers or just in the healthcare system in general, which basically puts it at the same rate as France or Italy, which countries that really don't have a significant issue. So that's the great thing is when you actually do things right, you just don't have that problem. Because, in the case of Rosen, we're talking about physical therapy. They thought going in with their clinic that maybe they'd need a physical therapist perhaps half a day a week. Well, they have a physical therapist full time, and it is so worth it. It's not only avoided the opioid addiction issue that so many face, but it's been a big driver of how they have saved significant amounts of money. If you can believe this, 2% of the entire U.S. economy is tied up in non-evidence-based musculoskeletal procedures. 2% of the entire economy. It's basically 50% of what we're doing in the musculoskeletal visit, for joint issues like back pain, knee pain, and so on, isn't based on evidence. It's kind of crazy to think about.
That is absolutely, I can't even believe that. It's absolutely insane. Because you think that with that high percentage, because 2% is a lot if you think about it over a huge populace. And when we talk about finances, that's a lot. And so it leads me to kind of question, what are some of the priorities of the healthcare system? Because it seems that their priorities are different than what it should be for the patient.
The incentives that the system operates against have really been volume-based. So if you prescribe something, you do a procedure, you get paid more. To the credit of Virginia Mason, which is a great hospital in the Seattle area, they did a study with Starbucks on spinal procedures, and they found that fully 90%, 90, of the spinal procedures they were doing didn't help at all. That things like physical therapy would have helped more. And so, again, to their credit and against their own financial interest, they changed the approach. Unfortunately, most organizations haven't changed that approach. They continue to do spinal procedures at extraordinary rates. And you see, very prominent people like Steve Kerr, the coach of the Golden State Warriors, or Tiger Woods, who really been destroyed by, a lot of spinal procedures that, frankly, did more harm than good. And you think about people like that theoretically have access to the best surgeons, but, a great surgeon for a procedure that never should have happened isn't great.
No, not at all. It really doesn't help at all. So how do people decide about the right doctor to choose for them, the right, health system to choose for them? Because it can get really confusing.
It can be. And, generally, in the U.S. at this point, if you're not low income or elderly, you get your benefits through your job. And so usually it's your employer and the benefits consultant that they're working with who tends to make that decision. And that's where you see the employers, like I highlight in the book, that are really all over the country and all kinds of different organizations actually making that decision. And, what individuals can do is, influence, talk to their head of benefits in HR, talk to their CEO even, about, hey, the irony is the best way to slash healthcare costs is to improve benefits. And, it starts with getting primary care right. And what you want to look for is generally a primary care organization that is independent of the health system. Unfortunately, you tend to have all the wrong incentives when a primary care doc is working for a hospital. They're under a lot of pressure to refer people to all these other high-margin things. I sometimes call them the milk in the back of the store. Gets you in, but then a typical primary care doc can drive $5 to $10 million of revenue for, kind of in the referrals and so on that they do. And so it's important to get somebody who doesn't have that outside pressure and kind of creates a conflict of interest. And fortunately, there are these organizations popping up, at an independent level, and you can make this decision even, independent of, whatever plan. Some people do this. There's what are called direct primary care doctors, and they're the sort that are independent of those systems and, really having tremendous impact in terms of health outcomes and saving money on a downstream basis.
Yeah, it's interesting when we look at that. I think most people don't realize, that the hospitals, the doctors are their employees and they are expecting to generate revenue.
Yep, and what's happened over the last decade, particularly, is a lot of the physician practices have been gobbled up, and I think the pendulum will probably swing back, but you have a very large percentage. It's now over half of all docs are employed by health systems. And, if you happen to know any doctors, and talk to them at, your local football game or church or wherever you run into them, and they'll tell you the kind of pressure that they feel once they're inside of those organizations.
Yeah, and I've actually heard them say, I'm thinking of one in particular where they really do have a quota of certain procedures they're supposed to do every year. And so it's, I could see where that would be a lot of pressure for them to do that because it really takes away from patient care.
Yeah, and there's a lack of accountability. In fact, there's a new TV series. It's in its second season called The Resident, and it was inspired in large part by a great book by a Johns Hopkins surgeon called, his name is Marty McCary. And the show really, I'm actually full disclosure, I'm now a consultant on it, for season 2. But it actually does, in an entertaining way, illustrate the perverse incentives that exist and the pressures that face inside these organizations. So, if you want to go binge watch something, every story, of course, they have to be entertaining and, have romance and stuff like that, but every story in there, it may be an outlier. It's not saying all doctors are like that, but they're all based on real stuff that's going on out there. It's very eye-opening.
Well, they must have just a real insight on how things could be with you, consulting with them, and no wonder that show's such a big hit.
Yeah, no, it's been fun to realize that they're so hungry for this type of information, and sometimes they can't believe, what they hear, and I'm not the only one. There's certainly, and I don't have creative control, just to be clear, but they draw on a wide array of experts. Most of them are physicians. They just want some folks on the business side as well. I'm not a physician, but people like Marty McCary are, and, they have physicians, literally on the set. Because they want to make sure that they're representing things fairly, even if it's at the extremes. But these are human institutions, and if you don't have safeguards in place and you don't have accountability, those things can continue to happen at really unfortunate rates.
Well, and we've talked about choosing the right doctor and healthcare system. How about the right healthcare consultant, benefits consultant? Because I know a lot of times that's just like a big dark hole of we don't know where we're going to go,
Yeah, I would say that this benefits consultant, benefits broker role is probably the single most underestimated role in the entire economy, if you can believe that. Generally, companies, for better or for worse, and unfortunately it's mostly been for worse over the last couple decades, defer the decision to their benefits consultant, because they're busy and under-resourced. It's a mistake a lot of employers make is they don't put enough focus on this. And then they defer to this benefits broker who too often represents themselves as, in a sense, a buyer's agent representing the buyer, but they're paid like a seller's agent, and that creates massive conflicts of interest. We work with some of the best benefits consultants, benefits advisors, sometimes they call themselves, in the country, and they will go in and kind of clean up, messes, and you'll find 17 undisclosed revenue streams that the employer had no idea about. And I can assure you those aren't in the best interest of the employer and ultimately the employee, because, you can say the employer is paying the premium. In reality, it's a 70-30 split on average, 70% paid by the employer, 30% by the employee. But in reality, a dollar is a dollar for the company, and the dynamic that's been created over the last 20 years and how it's not been well managed, it's created a 20-year-long economic depression for the working and middle class. One definition of an economic depression is 2 or more years of income stagnation or decline, and overwhelmingly, like 95% of the reason why the working and middle class has had essentially no wage gain in the last 20 years, it's healthcare. Very clear. And so it is your dollars, even though it doesn't feel that way sometimes. It is absolutely your dollars, and that's where your raises have gone.
And, you were talking about that there are these hidden benefits for employers. Are there also these hidden costs that they're not realizing that they're paying that can bring down the healthcare costs?
Yeah, at the end of the day, you're paying for these procedures that don't work. You're paying for a lot of administration. There's a lot of kind of crazy fees that are built in. One of the areas that's finally getting some attention is in the pharmaceutical spend area, where there's these so-called pharmacy benefits managers who are supposed to be operating in your interest. And believe it or not, something that's just kind of a small part of the supply chain, in the pharmaceutical area, if you think about other businesses where they're moving products around, maybe the distribution channels might get 5 or 10% of the dollars. They're getting half of the dollars, these pharmacy benefits managers. These are some of the largest companies in the Fortune 500. And once again, you think that they're operating in your interest, but generally they haven't been. And the evidence is very clear. You see pharmacy spend for a typical health plan has gone from less than 5% of the spend to 20 and even 30% of the spend. So that's another big area that, once employers awaken, it's very low-hanging fruit to fix that, like some of the other areas.
Well, I think it's very encouraging for people to hear that because, it seems you look at this, how this whole healthcare beast runs, and it seems that it's really overwhelming. And your book, The Opioid Crisis, The Wake-Up Call, really had it broken down into pieces where people could understand exactly what's going on.
Yeah, it's funny. I get this reaction from people where they look at healthcare a little bit like Middle East peace, where, they'd like to solve that, but it seems kind of hopeless and out of their control. And, really I try to debunk that in the book. And if there's one word that I hear more than any other when people give me feedback on it, it's hope. Hope that they can actually do something about it and that there's clear action steps that, they become quite clear that the cavalry is not coming from Washington, D.C. to fix the problem. The fixes are happening community by community, whether that's community as a union, it's an employer, it's a town. And that's the story that's not being told enough is, it's kind of a do-it-yourself health reform movement. And it's really happening, and we're just trying to kind of pour gas on that fire and spread the word about it. And the thing about the opioid crisis is it's kind of a way into that broader issue because people are aware of it. But as you saw in the book, it talks about the broader issue that's going on that's even bigger than the opioid issue.
Without a doubt. Well, and I know in your book you also talk about the fiduciary risk that people don't even realize that's there. It's like the undisclosed risk. And I'd love for you to expand on that for us.
Yeah, there's this idea of fiduciary duty is one where you're shepherding somebody else's money. And so in the employer realm, there's a regulation that was called, the acronym is ERISA, passed during the Ford administration, and it oversees retirement benefits and health benefits. And, the basic idea, on the retirement benefits side is, it's your money. You are using a third party, the employer and, the financial managers to steward that money. And, if they were to put your money into, Uncle Bubba's investment fund that has high fees, terrible returns, and there's kickbacks, that fiduciary duty kicks in there and says, no, you can be sued. There have been lawsuits, class action suits that have gone all the way to the Supreme Court for things like the plan paying retail commission rates when they should pay wholesale. But the part that hasn't been attended to as much has been the health benefits side, in part because they kind of looked at it as, the employer is picking up the tab, so they're not stewarding somebody else's money. Well, that doesn't hold water, and clearly today, when it's a 70-30 split, and half the workforce has over $1,000 deductible, they're clearly stewarding somebody else's money, and thus the fiduciary duty applies. And so that's where you're starting to see some legal activity, saying, gee, these all these people were going bankrupt, 70% of which have, because of medical bills, 70% of them had insurance. They start paying attention, and they say, I'll just use a really goofy example, but it's a true one. Literally, your PPO plan is paying over $400 for a mucus collection device. You and I would call that Kleenex. And so as people step in and look at that, they will see, oh my gosh, they have not been carefully stewarding my money, and there is a fiduciary duty. And so I hate that it has to kind of get to this legal dynamic, but unfortunately that's probably going to be the thing that for some employers kind of provides, a wake-up call right there.
Yeah, it'll start making some change because that's just ridiculous. You look at that and you're like, wow, this is just a total waste of money. When it's insane that that's happening.
Yeah, I mean, earlier in my career, I was responsible for helping hospitals with their accounts receivable and getting bills out and all of that. And I can assure you there has never been a bill that is over $10,000 that doesn't have an error in it. It's just, it's a little difficult, because of all going on. But there's a lot of gaming going on in the system right now. It's gone from a dynamic where the hospitals just want to ensure that they billed for everything that had been incurred. That you can't blame them for that. But unfortunately, it's gotten to the point where it's just become abusive and arbitrary and really extractive. And there's charges where, literally from one bill to the next, the same thing is being charged 10 times more, just because nobody's paying attention.
Wow. Well, and it really, you have to be your own advocate and pay attention to what's happening. And some of these things, it's hard to tell. If you have a surgery and they use 10 sponges or whatever, who's going to know that, if they charge 20?
Yeah, but there's other things that, it's kind of crazy. This one large, household manufacturer, as they dug in, they were seeing really pretty extraordinary rates of, because there had been some fraud and it hadn't been paid attention to, where, people were having, in the craziest one that I heard that's quite memorable was, was a steel worker that there had been claims run 6 times in 6 days from 6 doctors for 6 circumcisions. And this is a 40-year-old man. I'm not a clinician, but I'm pretty sure that's not medically possible. And those had been paid. You can believe that, because each individual item had passed the little claims check. So that type of stuff, that's, of course, pretty extreme, but it shows you the kinds of things that are happening where things are being charged multiple times. And yeah, sure, you may not know whether 8 sponges or 4, whatever used, but that's pretty small. It's these other things that, boy, if you're looking halfway closely, you can figure out.
Yeah, it is just interesting. I had a friend who had a surgery, and it cost her $250,000 what they billed the insurance. And so you look at these huge amounts, and it's impossible to go through these kind of things. It's like, wow, how do you can't even touch that? And then if you're responsible for a portion, it all kind of trickles back to the health insurance and just how that's all being managed. So you could see how this all has like a kind of a trickle-down effect.
Yeah, and there are, one of the things that some clever employers are doing is they're saying, hey, for sure you have third parties who can scour bills and find problems, but there's other things where, the patient or their family is actually very good at catching stuff, and so they have a program where they say to the employees, hey, if you catch a item that was on your bill that we were going to pay for that was not appropriate, we're going to give you 20% kind of finder's fee. And one of the employees found a $200,000 charge that was not legitimate. They were going to pay for that. They didn't, and so they got one of those Ed McMahon checks, cut her a $40,000 check, and this is a woman who was making about $50,000. So you can imagine the rest of the employees, how they started really looking at those bills. And you can find that stuff a lot of times. It takes a little bit of effort, but when you have that kind of reward, you're willing to do it.
That's some pretty good incentive there, right?
Yeah, definitely.
Well, Dave, your book has so much great information. There's absolutely no way we can even cover the tip of the iceberg here, with the opiate crisis wake-up call. Where can people connect with you and learn more about not just your book, but be part of your community?
Yeah, the best thing is just to go to healthrosetta.org, and you can actually, your listeners can go download the book for free there, the PDF version. If they want to buy it, that's great too. But we think of the site, it's very focused on the benefits industry, but we have information up there, sort of like, Wikipedia for how to buy benefits well. We make it available, and there's a number of ways you can connect in depending on what your role is. And, we're relatively young organization, so we're going to continue to expand. And, over time, we already have things that employers can do and unions can do, and, benefits consultants can do. We're continuing to add, you're a PTA leader, you're a faith or social service leader. We're going to be offering more and more things, just to give people, tools, so it empowers them to do this. And that's how these things get fixed, kind of bottom up, brick by brick.
Well, I think everyone that's an employer needs to pick up a copy of your book, doctors, everybody, so they can start making those changes within their community and at least asking some of the questions like, how can we start? And your website's a really good place to start with that. Dave, thank you so much for taking the time to be on the show with us here today.
Well, it was my pleasure. Really, thank you for the opportunity for being on.
Well, thank you, Dave. It has been such a pleasure to spend this time with you and, of course, to talk about your new book, The Opioid Crisis Wake-Up Call. Again, if you'd like to learn more about Dave, you can at healthrosetta.org. We'll have the link below. And also make sure to check out his new book, which is available at Amazon, Barnes & Noble, and of course, all indie bookstores. Well, we're at the end of our time today. I would like to thank everyone for tuning in. You're listening to Moments with Marianne. And remember, make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Moments with Marianne airs every Thursday, Friday, and Sunday at 8 p.m. Eastern, 6 p.m. Mountain Time. Make sure to tune in and visit momentswithmarianne.com for more information.